am Dr. Sharayu and today I am going to teach you how will you measure blood pressure. So these are various types of BP apparatus here. This is manual, this is also manual, this is digital, and this that is the another one which is on the stand. This is another one which is on the stand. We use this stand in operation theatre. So I am going to tell you how will you measure blood pressure manually in patient. So we need to see what are the parts of this BP apparatus. Take closer view. This is what called as sphygmomanometer. This is what called as sphygmomanometer. Sphygmomanometer has the rubber bag where the air is accumulated and that pressure is created on the arteries, and this is the cover, and here the attachments are there so that with the help of this you can fix this sphygmomanometer to the patient. So, and this is the bulb, this is the bulb, this is the lock, and this is how you lock, and this is how you unlock. Here somewhere there is a small hole from which the air is entered and air that comes out when you release open this lock. This is the bulb. Here is another attachment. This tube is attached to this one, and this tube is attached to this bulb. Whenever there is some blockage here, you have to remove the blockage, and then you can take blood pressure very easily. Sometimes it gets blocked. Here again there is one attachment. Whenever you are not able to take the blood pressure, then you clean this. So I am telling you all this attachment. This also comes up. This is the mercury chamber. This is the mercury chamber. Here is mercury, and this is the lock. When you make this lock vertically, it is locked. This mercury doesn't come from this chamber and enter here. And this is how you unlock. Unlocking, which will cause raise of this mercury column. So this is the manual blood pressure apparatus. Here are the markings. This is the mercury column. These are the markings here, and this is the column. See how this column raises when we create pressure. I'll show you in the patient. I'll demonstrate it in over the patient. So this is the So this is the manual blood pressure. There are two types of blood pressure we measure. One is the systolic and another is the diastolic. Systolic pressure is that pressure when the blood is flowing through the arteries when the heart is contracting. Means systolic is when the pressure is at the stage when the heart is contracting, and diastolic is when the heart is relaxing. So that is the minimum blood pressure in the arteries, because the heart is relaxed and the blood flow is that much diminished, and when the heart is contracting, the pressure in the arteries is more. That is systolic, and diastolic is during relaxation of the heart. So these are the two systolic and diastolic blood pressure we measure. Now we will see on the patient. Position. In the lying down position, this is the right hand. The idea is to keep this both tube on the lateral aspect of the hand. So this is the way how you will fix the blood pressure apparatus in sphygmomanometer in the patient. we will lock this before we measure the blood pressure. You palpate the brachial artery. You palpate the brachial artery. Then raise the blood pressure here. You raise the mercury column till here we can't feel any brachial artery pulsation. Now you slowly release. Concentrate on column. You can see the dancing of the mercury column. Stop झाला. Her blood pressure is 100 by just 80. But you can see the column dancing very nicely in the page. This is how you will fix this. In this way, you will see one notch here. You have to keep this in this way. And then adjust for all tubing inside this apparatus and then close it. Here is the knob. You close and then you open. You close and then you open. This is the manual blood pressure apparatus. Here I will like to tell you the method we saw on the patient. We measure the blood pressure without using stethoscope. Here you can't see properly the dancing of the mercury column, but when the patient is hypertensive, then you can very well see the dance of the mercury column. And if you don't have stethoscope, then the dance start, that is systolic, and dance is finished, that is diastolic. So without using stethoscope, you can even measure systolic and diastolic blood pressure. And if you are using stethoscope, raise the mercury column till this brachial artery pulsation get disappear. Don't raise immediately 240. That will cause unnecessary pressure on the arm. Just you palpate the brachial artery and raise the pressure till the brachial artery pulsations get disappear or radial artery pulsation get disappear, and then start listening the arterial sounds, beats. Then the pulsation from where the pulsation start, that is systolic, and where the pulsation you can't listen, stops, that is diastolic. Pulsation starts, systolic. Pulsation disappear, that is diastolic. That is how you measure with stethoscope. Stethoscope should always be kept in medial aspect, and this tube you adjust on the lateral aspect. Medial aspect, if you keep the stethoscope in this way, you can listen the blood pressure very nicely. This is one. Then another is the digital, which is very easy. Focus here. Here is the systolic, here is the diastolic, and this is the pulse. So here just you have to start and fix this sphygmomanometer on the hand of the patient, and you will get all these readings automatically. Then this is the another. Again, funda is to keep the tubes on the lateral aspect. You can fix this watch like instrument here in this way, and then you raise this needle will go up, and then you can measure the blood pressure accordingly. But remember, always, whenever you are using any manual apparatus, you will have to keep one hand on the radial artery or keep one hand on the brachial artery and see when that pulsation get disappear, you inflate this balloon till that point only. Don't go unnecessary up to 200, 250, etc. Then this is again the same apparatus. You can disconnect this sphygmomanometer if you want vertically and you want to only use one, then you can disconnect and attach here. This is one of the method. So here I have shown you four types of blood pressure apparatus. These are manual. This is called sphygmomanometer, and this is the BP apparatus with mercury column. Always take care to keep this properly. Always keep in mind that this should be on the lateral aspect and the medial aspect is for listening arterial beats. So this is how you will measure blood pressure in the patient. Then what you will do, like, share and subscribe please, and share my channel. Thanks for watching.
डान्स स्टॉप झाला.